That's it started.
Thank you. Good afternoon, everybody. Welcome to the 25th of June meeting of East Lothian Integration Joint Board. I welcome all members of the Integration Joint Board and also all the staff that are presenting today. And I'll pass on to our clerk, Fiona Curry.
Thank you, Chair. I'll start off with the GDPR announcement. This meeting is being recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council and NHS Lothian are the data controllers in terms of the Data Protection Act 2018, and data collected as part of the recording will be retained in accordance with their policies on record retention. The webcast of this meeting will be publicly available for up to 5 years from the date of the meeting. I'll now move on to take the roll call of attendees. First of all, we have apologies from Jonathan Blaisby, from Andrew Cogan, from Elizabeth Gordon, Maureen Allen, James Blair, and Sarah Gosner. Are there any other apologies? No. Then I'll proceed to the attendance by roll call. Shameen Akhtar.
I have apologies from Lynn Byrne. I'm present.
Thank you. Liz Allen.
I'm present.
Jeremy Finlay.
Present.
Carol McFarlane.
Present.
Patricia Cantley.
Present.
Thank you. David Binney.
Present.
Darren Bradley. John Hardman.
Present.
David.
Apologies for having my screen off. I've got IT problems. I'll be back soon. Thank you.
No bother, thanks. David Hood.
Present.
Thank you. Kalonde Kasangeli. Liam Kerr. Claire MacDonald.
Present.
Thank you. Claire McIntosh.
Present.
Mike Porteous.
Present.
And Fiona Wilson.
Present.
Thank you. And do any members have any declarations of interest on any item? Kalonde Kasangeli.
Sorry, I had an issue with my system. Just saying I'm present in case my name was called earlier. Thank you.
Thank you. That's us ready to start the business, Chair.
Thank you. Thank you very much. We'll move on to agenda item number 1, which is the minute for approval of the last meeting, which took place on the 28th of May. I will take that all the notes have been, you've read them, and just to check if there was any points of accuracy on any of the minutes. Nope, I don't see any points of accuracy. And any matters arising? Any matters arising on page 1? Page 2? Page 3? I know that Maureen isn't here today. One of the areas that we did discuss at the last meeting was an update on progress with the compact agreement. That's quite a big, significant piece of work that's taking place. And I know from the last meeting that Maureen had indicated they were waiting further update from the Scottish Government. I think that's maybe something that we could keep on the action log to make sure that doesn't fall on the wayside, that we keep updated on the compact progress and any support we can give on that area of work. The other point on page 3 was James Blair spoke about being able to provide some support, and there was an action point for Kate Thornback to get in touch with Mr. Blair, and I just wanted to check if that had happened. If it hasn't, then if we could place that on the action log.
So, Kate, I'm not sure if Kate, I'm aware that Kate I've let her know, and she's probably in contact with James anyway. I'll drop her another email just to double check, and James can follow up, but I know they're in contact anyway.
That's great. Okay, thank you. Any matters arising on page 4? On page 5? On page 6? I know that it's in the action log was the gap in the on the financial year. I know Jonathan Blaisby and others had raised that at the last IJB, and I know it's in the action log. So when we get to that, it'd be useful just to get an update on that one. Okay, that's all the matters arising. If we could just go through the action log, which is agenda item, part of agenda item 2. So on the action log was the performance, the IJB strategic plan and the performance framework. And I think I take this down as still being an ongoing piece of work. Don't know if there's any feedback on that one.
Yeah, it'll come to the IJB in September.
September, okay, thank you. We'll take a note of that. The other items were around positive recognition and partnership working, and that was with Mike Poaches. Best value compliance review, he would keep that under review.
Yeah, that's being kept under review. We've got a best value compliance report coming up later on this year.
Okay, thank you. Agenda item 2526 matters arising was feedback from the Scottish Government on the response on the weight management medicine when that came to the IJB. I know we had quite a significant discussion and debate on that around getting feedback from Laurie Isles, who said she would communicate what was raised at the meeting with the Scottish Government. David?
Thanks, Chair. I agreed to follow this up with Laurie following the last meeting. I haven't got an update as of yet, but it is on the agenda for the Chief Officer meeting on Monday, and Mid Lothian are going to give us an update at that point. Following that, I can update members just in terms of the feedback, unless Fiona's got more information.
That's good. That's really helpful. Thank you, David. Fiona?
Yeah, and apologies, Chair. I had followed up with Laurie after, because she was going to do that from speaking. She had shared the information, had fed back that there was no tangible actions from Scottish Government at that point. So I believe I have fed that back before. So I'm sorry if that's not been picked up. But also, if it's going to chief officers, I think David, you're going for me. So if there's anything on that, we can update.
That was great, thank you. I think one of the main issues was that while we recognise the importance of agreeing the weight management medication, it was that more medicines were being put forward, but there wasn't additional resource to be able to take that forward, and that it would be an additional financial pressure for the IJB, not just kind of in the short term, the longer term, and just making sure that Scottish Government recognised that that was going to be the case. Okay, thank you. I think the discussions around set aside and budgets would be picked up as part of the development session programme. David?
Yeah, just to kind of reflect what you just picked up there, Chair, that the plan is that we'll invite colleagues from the acute system to a development session later on in the year, and we'll be able to have that conversation at that point.
Okay, thank you. The next agenda action point was around the update on the guidance for voting rights. I've not seen anything else come through, so unless anybody else has got any further update, Fiona?
Yeah, we've asked Paul to do a bit of work with Hayley and Darren. We're hoping that we can do it as a kind of cross Lothian approach. Hayley Barnett, I've now lost the monitoring officer and the council standards officer for the IJB. She was keen to do it, but we also didn't want it to be done independently, so we were keen there was a whole system approach. So an email has gone, and Paul, you're copied into that with Hayley and Darren. She was hoping to do it more in the recess period, and would pick that up just around the approach, Chair. So we are trying to move that on.
That's great, thank you. It'd be helpful to, if we can, of a cross-Lothian approach, that we're supporting each other. I think everybody's going to be in the same boat of trying to make sure that we interpret the guidance the best that we can and provide the right level of support to the voting members. Sorry,
Chair, it's Darren Thompson, who's the Board Secretary for NHS Lothian, just in case people weren't aware.
Okay, thank you. The IJB delivery plan recommendation to receive a report on the delivery of the 26-27 at this meeting in May, alongside with the updated ADP for 27-28. And that was to add the IJB reporting timetable, which feeds into the future agenda setting. Okay, so we've got the directions today, and I know that we discussed the delivery plan at the last meeting. I don't know if there's anything that you wanted to add to that. Okay, thank you. The IJB delivery plan, which we've covered, and the year-end financial report. Yeah, just to ask Mike about the reassurance following on from the last meeting on the financial gap, if there's any feedback you wanted to provide on that.
Yeah, thanks, Chair. I think the best way I can give that assurance is to sort of explain how the funds flow through the health system, because it's a long established process. So it has been in place for a long time as well, before IGBs came into existence, and it's custom and practice. So every year, once the Scottish Government has produced their budget, they write to the Health Board, or all the health boards, and advise them of the base funding for the coming financial year. So NHS Lothian has that letter, and that's the basis of the letters that it writes out to the IGBs with the funding offers, because the NHS Lothian can only pass on funding that it's aware of it in terms of what it's received or what it's been told its budget will be for that year at that point in time. So that forms the basis of the letters that go out to the IGBs in terms of funding offers. And the model that's in place, as part of that letter, the Scottish Government advises the health boards that there will be additional allocations made in the year. So it makes that clear in the letters. So that's how the funds flow through the system. Just as an update, we have the letter that we got, if you recall, stated that our funding offer was 133 million for 26-27, and the balance that we now have, the budget that we now have at the end of month 2, is 150 million. So that reflects all the additional allocations that have come through in the first 2 months, and a lot of them are around things like uplift for pays, non-pays, other sort of elements of funding that we get separately at the start of each year. So hopefully that gives everybody more assurance. The only other thing I would add is that there is no concerns from an audit perspective, either external or internal, about the process that's in place. So it's a well-established process, it's custom and practice, and it's been in place for a long time in terms of how the funds flow.
Okay, thank you. So as long as we've got reassurance that that gap will be met during the year, that's helpful to know. It's just comparing to previous years, that gap was much bigger this year, and I think that's why it was rightly so raised at the last meeting. Fiona?
Yeah, I think it came up as a question at our catch-up meeting, and I know it's been a similar question that has been raised within the council. So you were included, as was Andrew Cogan, just in response, copying in Craig Marriott, Director of Finance, and Sarah Fortune, just really what Mike's explaining, but just in a transparent way. I've not had any feedback to say otherwise, but just again, that concern is it is an accounting mechanism. We're not wanting to go and look for savings because there's a gap, because we're not anticipating that's a risk. It's custom and practice year on year, but just for extra assurance for the board, that has been raised through an email trail as well, so that we've, much as Mike as our CFO is explaining it, it's been docked. And I know Andrew Cogan has had a conversation with Craig Marriott. He is not concerned, just he's assured by that process. So we've done multiple mechanisms and included partners in that as well, Chair, just for assurance.
Okay, thank you. I think just as long as we've got that reassurance and we can note that it won't be something that we have to a gap that requires savings to be made, and that gap will be met during the year, and we've got reassurance from yourself. So it'll be useful just to get you've said that the gap has has changed from 133 million to 150 million as a result of some of the resources flowing through. So I think it's important that we keep an eye on that as an IGIB and ensure that's what's happening. Okay, thank you very much for the updates. Thank you. Move on to agenda item number 3, which is the Housing and Health Delivery Group work plan, and that will be presented by officers.
Yes, thank you. I'm presenting today on behalf of HSCP, and we're also joined by Bex Aston, who's the Service Manager for Housing Strategy, Policy and Performance, for any discussion afterwards. So the purpose of the paper is to inform the board of the approved work plan for the Housing and Health Delivery Group. The group's got a dual reporting line to both ELC Housing Partners Board and through the HSCP Community Health and Social Care Programme Board. Both these groups have approved the plan, and it was also endorsed at Strategic Planning Group recently. So the work plan set out contains 7 primary activity areas, and these were identified through the Housing Contribution Statement. And that statement brings together the local housing strategy and the HSCP strategic plan. Each of the actions in the work plan has got 2 designated leads, one from HSCP and one from housing, so really reflecting a commitment to joint working and a partnership approach. So I'll just comment briefly on the kind of 7 areas. The first priority is a 2-year programme for a mental health needs assessment. We require a full needs assessment and options appraisal to understand future mental health accommodation needs, including planning for Elder Street, which is an existing recovery service. So we know that delayed discharges from Royal Edinburgh Hospital, while small in number, do have a significant impact. So commissioning mental health recovery services in the community is a priority, and we're looking to shape these with neighbouring partnerships. The next 2 actions in the plan relate to the core and cluster approach. So for those that don't know, aren't familiar with that, the core and cluster model provides self-contained housing, so that's the core, alongside on-site or nearby shared support and care services, the cluster part, and that enables people with complex needs to live independently while accessing flexible, responsive support. So there's 2 elements to the core and cluster. One is an economic and social value analysis paper, and that will be used to inform future commissioning and investment decisions. The second is the core and cluster strategic plan with affordable housing programme. So in 25-26, 13 units were delivered for people with complex learning disability and mental health support needs, and we need to carry out further needs assessment to establish future needs. The next area in the plan is more of a process issue and has actually already been completed, so that's the review of the housing episode forms. The process captures current housing needs across all service user groups, including hospital discharge, so it creates quite a solid foundation for our needs assessment and future planning. A further action is the all tenure adaptations review. Now, we haven't started this yet because the work stream, the plan is to commence that following a completion of a Scottish Government review. But clearly we recognise that adaptations are not optional extras, they're often vital in supporting people to live at home for longer. And locally we've identified a need for a full review of adaptation services across all tenures. So the current services in East Lothian there's 2 services. One service is accessed by owner-occupied or private rented sector, and the other which is accessed by people who reside in local authority housing. So best practice would be these services to be combined to offer an all-tenure approach, and that would deliver better outcomes. We've also got some actions in the plan around the dementia strategy, which has already been agreed at IJB, and the key actions really reflect that housing is as a key determinant of health and independence. So one of the main areas to progress is to embed housing discussions at the point of diagnosis, as well as in the post-diagnostic support provided. And the final area of the work plan is in relation to the complex care unit and development planning at sites such as Herdman Flat and Mansfield Road. So we're already underway with an initial needs assessment to establish needs. There's a need for a wider repatriation review. So repatriation refers to the planned process of supporting a person to return from an out-of-area placement back to their local authority area. It's a longer-term piece of work which will help us look at and ensure that people are not placed far from home simply due to historic commissioning decisions. But that piece of work will also underpin the wider needs assessment that I've referred to. However, we know that once people are out of area for a significant period of time, they tend to want to remain in that area. So to be clear, this process is not about requiring individuals to move, rather it's about identifying the need for local options that may better serve a person's interests and support their outcomes more effectively. In terms of background to the report, the engagement has been completed for each aspect and will continue to do that for each work stream. There's no policy implications. The work is already aligned to the IGP strategic plan and the local housing strategy. We've not done an integrated impact assessment on this high-level paper, but it will be core part of the needs assessment and the plans coming out of that. In terms of the resource implications, there's no specific resource or financial implications for this high-level plan. These will be identified as part of each of individual work stream. So in summary, the work plan is progressing as we intended. All work streams are green, and I think this demonstrates a significant strengthening of the joint working arrangements between HSCP and housing. So just to summarise the recommendations for the board, in 2.1, it's to note the work plan and the RAG rating set out in the paper, and 2.2, to endorse the Housing and Health Work Plan, which is governed by the Community Health and Social Care Programme Board. So I'll pass back to the Chair and happy to pick up any questions.
That's great. Thank you very much, Christine, and thank you, Bex, for coming along this afternoon. Can I just open this up for any questions or queries, both for Christine and Bex? I don't see any hands up. Can I just start off by just asking around, I think it's really important to fully recognise the impact of some of this work, and you've mentioned that in your economic and social value analysis paper for the core and cluster. I think that's really, really important, because this is quite a significant piece of work, because you've mentioned yourself only 20% of health inequalities are as a result of health. The rest are a whole range of other issues, and a significant portion of that is due to health and housing. I just wondered if any of that work will also then look at the other parts of your work streams around the social value and economic. So that's great that you're doing it on core and cluster, and that's really significant. Will that then also impact on the other work streams, that you'll also look at the economic and social value of that? Because we're just seeing more and more individuals with long-term health conditions that require appropriate housing. It may be coming out of hospital or being able to stay longer in the local community. So it was just around the impact, not just on the core and cluster, but the other areas of work, which I think impact is significant.
Sure, no, absolutely. So the core and cluster work will be interesting, because, as you say, we're looking not just at the economic, the social value, but with the impact on the personal outcomes that are achieved for the people in core and cluster, which is not specific to learning disability, it's broader to mental health. We can look at what the requirements would be, particularly around the mental health needs assessment, around carrying out a further assessment. Obviously, it's a capacity issue for staff, so that's why we've got this phased approach set out. But absolutely, it's always really valuable to have an outcome and an evaluation of the value of some of the new models that we were proposing, and that when they are implemented, that would be a plan and a commitment to do that. Yeah.
Okay, thank you. And just on the first one around mental health needs assessments, you've mentioned in there around small in number but significant impact, and I just wondered if some of those impacts will be shared with NHS colleagues who work in the Royal Edinburgh Hospital.
Oh, absolutely. I mean, I think that the colleagues in the Royal Edinburgh will be very aware of the impact of the lack of options for the people that are having to remain in hospitals. So absolutely, clearly joint working with colleagues in mental health clinical teams, they're giving us the data for the needs assessment, and a key part of the process.
Okay, thank you. I did see another hand up. I don't know if it was yourself, Trisha, or was it yourself, Bex?
It was myself, Chair. So I was just going to come in on the back of the core and cluster conversation, and just in terms of, we are seeing more and more housing and health referrals, and whether that's a byproduct of our allocation policy or whether that is health declining, but we are seeing more people for the first time living ages falling for those that are living well. So that social impact needs to be measured across all of that in terms of placemaking, where we're building, and our allocations around all of that. So that is a key piece of work to take away alongside the core and cluster work as well.
That's great. No, thank you very much, Bex. It's good to get that reassurance that that's what's happening. David, would you like to come in?
Thank you, Chair. Christine, what you've been talking about, it strikes me that there must be quite an element of ability for staff working in those areas to be able to identify carers and to signpost carers. Is this happening? And B, is there adequate staff training and support to allow them to do this work and to build on it?
Yeah, thank you. So for the existing core and clusters, we have contracts with providers who are delivering the care and support element, and part of their reporting is around identifying carers, so we're able to bring that information out, which is key. And obviously, moving on to discussions that will come later, you know, the carer strategy is absolutely vital for the partnership, and all of the work streams that we have in the housing delivery plan will also reflect where are carers in this, how can we support the objectives of the carer strategy, so there will be that join made.
Okay, thank you. Could I ask, when do you realistically think it's possible for you to come back and give an update on this work?
I would anticipate that we can report on the needs assessment in relation to Turdman Flat within the next 9 months. We're moving to quite a tight timescale on that, so I think we can share some initial findings and how that's shaping our recommendations.
That's great. Thank you very much. Just want to check if there's any other questions or queries for Christine or for Bex. I don't see any hands up. Thank you. I just want to thank Christine and Bex that this is a really significant piece of work, because we've talked a lot about health and housing, and just to see how quickly the Community Health and Social Care Board and the East Lothian Housing Partners Board have worked to produce this paper. And I think it's great that you have come up with a realistic list with realistic time scales of what's possible for us to take forward. I know, for example, if anybody that lives in Haddington, you will see the Herman Flats really kind of taking shape now, and so that's going to be a significant addition to support lots of residents across East Lothian to support their health and housing issues. Tricia, to bring you in.
I'm feeling a bit guilty that I haven't got clever questions, but I thought I would put my hand up just to make supportive noises and to agree completely with what you've said, Shameen, because I think, as you say, we've talked a lot about housing as being a key component to health, and it's one of the major, it's one of the major contributors to well-being and health. So although I don't have any clever or incisive questions, I want to make supportive noises and nod agreement. So I'm supporting this strongly. So thank you for that.
Thank you. Thank you very much. That's much appreciated. I know staff will appreciate that. So pass on our thanks to your teams. I suppose for us, because this is quite a significant piece of work for us to maybe consider to look at housing representation on the IGB, and that's maybe something that we have to go away and have a think about. But to thank just Bex and Christine for the work that's gone in this paper, and you know, as you make in that one sentence, it might be small in number, but this work is already having a significant impact on local residents and providing them with appropriate housing support, and to be able to live with dignity and respect in their local communities, and looking at the area of mental health and being supported in Elder Street in the county, rather than being in a hospital, which we all support. And it kind of reflects on some of the discussions yesterday at the NHS Lothian board around some of the challenges, and Tricia, you were there yesterday, some of the challenges and pressures that NHS Lothian faces. And I think a lot of this work is going to be a huge factor in supporting that work and supporting our residents, where they're trying really hard to keep people away from hospital and not at A&E, but be supported in the local communities. And a big part of that is having appropriate, adequate housing. Laura?
Yeah, it was just picking up on housing rep on the IGB. Just a reminder that we do have a SPG member from housing, and that's how housing are feeding into the strategic side of things. And we obviously have the set kind of housing members of the IJB, but yes, we definitely do have our rep on the SPG, which is positive.
Okay, thank you very much. And Christian, I welcome that you'd mentioned that we'd be able to get maybe 8 or 9 months time that some of the work that's going on at Hermond Flat. That'd be really, really welcome. But I suppose as an IJB, it sends a strong message if there's housing representation on the IJB that we take this seriously. We know there's an issue across East Lothian when we're seeing more and more health and housing applications coming through. So I really appreciate all the work that's going on. So for us today is to note these recommendations, and I think we're all supportive of them. I don't think there's anybody that doesn't support this work. So that's noted and agreed, and we endorse the work plan. Okay, that's great. Thank you very much. Thank you. We'll move on to agenda item 4, which is the chair's report. So apologies from Andrew. Just a couple of things I just wanted to mention of things that I've been involved in as vice chair. Just to mention that there's the Convention of Scottish Local Authorities, which has a health and housing board, which we are able to raise issues. So just for the minute, that the issue of support for adequate financial support for carers' breaks has been raised on behalf of ourselves, and the removal of non-residential care charges has also been raised, because I know that's something that's an issue that we've been continually looking at. A couple of other things that I've attended over the last since the last meeting is I attended the Dunbar Dementia Support Group with Maria Burnton to discuss our strategic plan and just talk to the group about the importance of engaging in consultation processes and feedback. So it was really, really valuable listening to them, and really valuable getting their feedback and be able to say that your engagement is really, really important. And I'm sure Maria will reflect on that Maria and Christine, when they talk about the carer strategy and the achievements that you've made. Other two things I wanted to mention: on the 8th to the 14th of June was Carers Week. So I attended a session organised by Carers of East Lothian at the beginning of the week. So I had the opportunity to speak to carers and also to staff at Carers of East Lothian of the support that they've provided. And I had an opportunity to pop into the community hospital and go into the Carers of East Lothian offices to thank them for the work that they're doing, and that'll be reflected in the carers reports that we'll see later on. From the 1st to the 7th of June was Volunteers Week. So I attended the 30th anniversary of the John Bellany Day Centre, and it was great to see that other day centres had come along to support them, and just to recognise all of our day centres have management committees, and those management committees are volunteers. So I had the opportunity to thank them and also meet them at the Day Centre Network to thank them for the work that they do as volunteers. And one last thing, yesterday was the NHS Lothian board meeting. And I think it would be helpful to share the board papers, which included a paper on becoming a public health organisation, and I know that paper will be coming to the IJB, so it'll be useful for colleagues to see that, and that very much reflects on some of the work that's going on here of how we support the work of early intervention and prevention. Okay, that was the only updates I had. I don't know if anybody's got any questions or queries on that. Nope, thank you. I'll move on to agenda item number 5. And that is the reappointment of IJB non-voting members. The paper is straightforward, and it was just to reappoint Dr. John Hardman as a non-voting member for East Lothian IJB, specifically the registered medical practitioner, whose name is on the list of primary medical services performers, and that's one of the important representations that we have to have on our IJB. And this reappointment takes effect from the 20th of June 2026 for a further 3-year term. So I don't know if Dr. Harmon, if you wanted to say anything, but we've just been asked to agree the reappointment.
Yep, that's great. Thank you very much. I'm happy to be reappointed. Thanks, Shamin. Thank
you very much. I think it's a straightforward. I don't know if anybody wants to make any comments or queries on this one. No. Tish?
again, just to make appreciative noises, I think John's contributions are always very helpful and valuable and come from the coalface. And I know that it's a particularly difficult coalface at the moment for people working in primary care. So just to add a note of my appreciation for all that John brings to the board. Thank you.
Thank you very much. I shall echo the comments that have been made. And I think we're all in agreement for the reappointment. I think I see quite a lot of nods. I don't see any objection. So that's agreed. Okay, thank you. I'll move on to agenda item number 6, which is the carer strategy 23-26, and that's to cover the achievements. And is that with yourself, Christina Maria?
Yeah, that's with me. So having presented an annual update at the SPG earlier in the month, the feedback was that a kind of review over the 3-year period of the existing strategy would be more meaningful in terms of looking at kind of trends in the carer population and identified needs. So we've updated the presentation slightly to try and represent that. Ailey, if you could bring up the presentation, that's the 23-26 one, please. So this has been East Lothian's second strategy, and it's been developed in consultation with local carers and representatives. The progress has been summarised in the paper under each outcome and in table in section 3.4, and I'll talk you through what's presented there just now. If you can move that on, please, Ailey. So our adult and young carer services continue to identify new carers every year. Carers of East Lothian are generally working with around 1,500 carers, actively supporting them in each year, and this year 625 of them were new to the organisation. The East Lothian Council's Young Carer Service was established just in October 2021, and in March 2022 we had just 39 young carers registered, so they've made a huge amount of progress in helping young people identify as carers, with I think 182 new registrations in this year and a total of nearly 900 young carers now known to the service, so that's been a huge growth there. Findings from Carers of East Lothian's survey in 2024 indicated that a relatively low proportion of the carers first became aware of Carers of East Lothian through their GP practices, and they felt that GPs are well placed to identify carers and provide that kind of early support. So they agreed to develop this dedicated resource pack, which they've shared with practices, and that's been completed and has a range of information in it there for GPs. The hospital link worker role, that's something that's been new over the last couple of years, and through this strategy it helps us meet our duty under section 28 of the Carers Act to include carers in hospital discharge. The first worker took up her post in May 2024, and she's been based on wards 3 and 4 at the community hospital, and we now have another worker that covers wards 5 and 6, so covering carers of people from across the NHS Lothian area. The role's really highly valued. The feedback from staff is really positive in kind of advocating for carers' rights and providing that independent voice between health services and carers. The project in this year has led to identification of nearly over 350 carers, with 72 of them going on to kind of access that more intensive and ongoing support following the hospital discharge. Next slide, please. Our commission partners continue to provide the advice, information and support services that we have a duty to do under the Carers Act again. The need for support around young and young adult carers was identified around that kind of transition point between school and work, and we now have Bridges project working, have a young carers support worker providing that person-centred one-to-one support to young and young adult carers at that kind of really important transition stage. The Health and Social Care Partnership and community partners continue to review and expand all our information that's available to carers. The dementia cafes have shown us a really good model of providing information to people and carers living with dementia, because they have the community mental health team and the social work teams attending on a regular basis to give that kind of informal advice and information. It's a really good model between third sector and ourselves. We also continue to increase all the information that's available to carers, looking at our website, producing resources, and we've done carers' rights videos and also a series of leaflets around carers' rights there. And last point on that one, Carers of East Lothian provide their welfare rights and advice service under their contract, but that has been extended by gaining external funding. They've been able to get a welfare rights accessibility post. They were noting that a lot of the people were not able to use their kind of phone line service and needed that additional support. So that's been really beneficial, and they've been able to support over 400 people to access a huge amount of money in benefits in the last year. Next slide, please. The Adult Carer Support Plan and the Young Carer Statements, they're designed to give carers the opportunity to have a supported conversation focused on what matters to them and what support will really make a difference to their health and well-being. From the service reporting, we see that uptake of the Adult Carer Support Plan is about 50%, indicating that there's still a bit of work to do there to achieve our goal. We're wanting that plan to really be the basis of the getting to know the carer conversation. The uptake of the Young Carer Statements was a bit higher at 69%. And just to say that it was noted at SPG, I think why that uptake rate potentially around adult carer support plans particularly isn't very high, but carers can access a huge amount of support without completing their adult carer support plan. It only gives a bit kind of part of the picture, so they might do a lot of kind of simple inquiries and information and advice without completing that document and then go on to do it at a different stage. So, but what we are trying to do is kind of establish that as the basis of that initial conversation so that every carer would have one. Our opportunities for peer support continue to give carers the chance to share experiences and learn from each other. There's been new groups in this year, including the Brain Health group in Haddington and a new peer support group that's running through one of our providers' neighbourhood networks. There's a huge number of attendances at the peer support groups that Carers of East Lothian offer, as well as they do additional wellbeing activities throughout the year. Counselling also continues to be available through them, offers emotional relief and help to individuals to develop practical and coping strategies to manage their circumstances. Next slide. Breaks from caring, we've heard quite a lot about recently, but fundamental to carers' health and wellbeing, and there's definitely a knowledge gap there between the need for and access to breaks. So between us and our partners, we are continually working to increase opportunities to breaks from caring, making small grants to a number of organisations to support this aim and committing to that on an ongoing kind of grants programme on an ongoing basis. Our Carers Act funding is also invested in local organisations that we think are well placed to support breaks from caring, such as our day centres for older people, Lukey's at Home service, and through Volunteer Centre, East Lothian's Community First project as well. The overnight bookable respite provision for carers of older people was recommissioned in this year with a new provider now in place, and occupancy levels are much higher now, up around 92%. The Young Carer Service as well, they are always adding new breaks to what they're able to offer. They've added DJing, Sky Academy, puppy therapy. They do all sorts of things, and a huge holiday programme in particular. Young carers are able to benefit from accessing active schools, from their Enjoy Leisure memberships, and a really big range of breaks there. And the other bit of breaks, Carers of East Lothian are also our delivery partner for what's called Time to Live, which is a kind of easy access route for breaks that is delivered through Shared Care Scotland, and the Health and Social Care Partnership contributes a top up to that to increase the amount available to local carers. Next slide, please. With over 60% of the carers that were new to Carers of East Lothian were actually of working age. I think in previous years we've seen carer centres being thought of as supporting older carers, but that's very much not what we're seeing now, and I'd say that's 60% that are in work carers. So I think we know how important it is for people to be able to balance that caring with their work. The Volunteer Centre East Lothian have just gained their Carer Positive accreditation, which is a kind of a bit like Disability Confident. It shows that employers are working hard to support their carers. So that's really positive, and they're going to help us in kind of encouraging other employers to do that through their networks. The Young Carer Service work obviously more in their schools and try and increase awareness there and understanding of the kind of competing demands on young carers' time. And they created a short film that some of you might have seen. It was launched in Carers Week and it premiered at the Fraser Centre. So that was really, really good turnout for that, and it was a very powerful message from our young carers. We also carried out a really significant engagement project in partnership with Shared Care Scotland, who are our national carers organisation leading on breaks from caring. It looked at the kind of experience of parent carers of children with additional support needs and their experience of that holiday period. It was quite striking because we were looking at activities and provision, but the thing that came out a lot as well was about carers feeling they can't access the places, spaces and activities that we can, everybody else can. So there's already a place-based advisory group that's come from that, and it's been working with the amenities colleagues and people in the council to make spaces really truly accessible. It's been very positive. Next slide, please. In terms of recognising carers as equal partners in care, we continue to deliver Think Carer training that's aimed at professionals supporting carers, and potentially that's something we could look at with housing, as was coming up earlier. We've also got national resources around kind of Think equal partners in care modules that are available to all our staff. The local carers' voices have been promoted in different ways, including we did some carers' stories videos, which were presented as part of your development session last year. We do regular engagement with Carers v Lothian's Carers panel and the Young Carers Advisory Group, just to ensure that those voices are really central to our planning locally. And I think came up at SGPG, that's how we made sure that they're included earlier before we're presenting our strategy for a kind of final approval. Last slide, please. So engagement with carers and representatives has been key to informing the development of this strategy and our refreshed one that I'll come on to. I mentioned the engagement project above, but we do work like that, and we'll be holding local and national information sessions to feedback what we've been finding. The Carers Programme Board meets quarterly. It's very active, as good representation of carers, of organisations supporting carers, and of the HSCP and council staff. So that is the summary. The IGB is asked to note the progress towards the outcomes, as I've just outlined, and note that a performance metric will be developed to monitor the performance of the refreshed strategy.
That's great. Thank you so much, Maria. It's a really comprehensive report on all the achievements. So I just want to start off by just recognising all the work that's gone into to provide that support to carers, and just to thank you for that. Jeremy?
Yeah, going back to the development of information packs for GPs. What's the feedback been on that so far since it was completed in January, and how would you measure success?
So that's not something that we developed. It was the carers panel who are independent of the HSCP. So that was something where they had recognised that the identification they felt was low there, but they did work very much with the GP practices to see what would be helpful and what might be able to support them in their role to giving more resources. So I don't think that they've had a huge amount of feedback yet. I think that engagement, although I think it says it was completed in January, went out, and they're trying to engage with the practice managers to get a bit of feedback on how that might be used. So that's a kind of ongoing bit of work under the new strategy as well.
Okay, thank you.
Okay, thank you. Do you have any other questions? David?
Thank you. I would echo what you've said, Shamin, that we must acknowledge the hard work and dedication and commitment that's been put in by our strategy officer and by the Health and Social Care Partnership. But it's also very important to acknowledge the work that the third sector organisations working in the carers field have done, and that the really important point is that it's the collective strength of working together that gives us the success that we've managed to achieve over the past 3 years. I turn now to a sort of thought, an observation. Adult care support plans. Maria mentioned that in the context of there seemed to be what appears to be quite a low number in relation to the number of carers being identified. And my experiences from listening to carers is that there's a degree of skepticism, almost suspicion or wariness about embarking into the adult care support plan process. And I think that's something that we possibly would wish to explore to see how it might be, how this perception might be addressed and overcome.
Thanks, David. So I think that would be really helpful because we recognise that people see it almost like as an add-on, and from our perspective, it feels like the adult carer support plan should be able to be completed. The carer support workers know the story so well that it's almost like that should be the basis of getting to know them rather than an additional task. So it's something we're reviewing at the moment. But as you say, important to include carers and hear those perceptions and issues before we get into that.
Okay, thank you, David. Any other questions or queries for Maria? Maria, I might touch upon the next report. Is one of the things that's been identified as 60% of carers are in employment, and I just wondered if carers themselves had come up with any suggestions or supports, because I know that you just recently seeing VCEL had received their accreditation for being a carer positive organisation, of other things that we may be able to support carers that are in employment.
So not specifically, I think there's a huge amount of research, some of the national stuff as well, looking at the impact of caring on being able to work and how many people are forced to either reduce hours or give up work completely. So we kind of know the issues, and I suppose to an extent there are caring roles where obviously flexible working and all the stuff under carer positive is really helpful, and there are some caring roles where it's just going to be more difficult to be able to continue working. And I think a lot of that is around access to alternative supports and not replacement care, because that wouldn't count as a break when someone's going to work. But I suppose finding enough suitable support for the individual so that the carer can continue working if that's what their choice is to do. It's definitely a challenge, and I don't think any carer has suggested any magic solution to that. But yeah, in terms of what we're looking at is just making employers more carer aware, making sure they're having those good conversations with people, knowing who their carers are in their workforce to start with, and then in whatever way they can, offering that flexible working so that carers can maintain that alongside caring.
Okay, thank you very much. And just one other final thing. One of the things that comes across from the achievements, and I absolutely agree with you, David, about that collective approach. So you're seeing different departments, different sections, third sector, etc., coming forward through in your report in the achievements that have been made. And I just wondered how we recognise that it's not just the Health and Social Care Partnership, it's not just Carers of East Lothian, but it's everybody's responsibility. And I think that of how we pull that out, because I think that I've seen this report grow in strength year on year, and how we get across that actually it's everybody's responsibility. And we'd want to be a carer friendly county in East Lothian, and that means that we're doing the best thing for carers and providing them with the right level of support that they need, as and when they need, but just how we get that across, that it's everybody's responsibility.
Yeah, I suppose it's something that's come up, I suppose, in the kind of awareness raising campaigns and things we do, because the carer strategy can do so much, but it came up at SPG as well around there are carers everywhere. Like you're saying, we were talking about palliative care, we're talking about housing. So there's an awful lot of work that is ongoing at the moment that's not necessarily under the carer strategy, but obviously impacts carers. And I suppose that's really key for us when we're making decisions for SPG and IJB members to be thinking about carers in relation to everything, not just when we're presenting that kind of the carers strategy. But I think, yeah, that general awareness raising thing we do around Carers Week, we make do a huge amount of communications, and kind of, especially this year, the focus was on that carer friendly communities, and I know the Carer Centre are hoping to continue some work around that. We've got our new carer ID card, which is just a kind of recognition of carers' roles. That's something that people have been pushing for a long time. So we just continue our awareness raising, and I think in workforce as well, there's a lot of actions there around Think Carer, and encouraging everyone, like you say, to recognise their role. So quite a broad one.
Thank you very much, Maria. I'm just going to check if there's any other questions or queries for Maria, or any feedback that you wanted to pass on to her. No, I don't see any hands up. I just want to particularly just echo your comments, David. I think we're really fortunate, David, to have you on the IGB board. You know, you're a real champion for carers and really value the contribution that you made. And I think one of the most powerful development sessions that we had was the one on carers that was led by yourself and Maria. So that was really, really powerful. And I really set the, you know, we've been committed over a number of years, but really just reinforced our commitment. So it's really important that we continue doing that, raising awareness of through development sessions and other ways to IGB members of the value and the importance of carers. And just to thank, you're absolutely right, not just Maria, yourself and all your team members, but all the volunteers, but especially to the team at Carers of East Lothian, do a considerable amount of help and support. And you've seen the numbers. I think in the table you can see just about in every area the numbers of have gone up on the numbers of new identified carers, number of young carers, the numbers of one-to-one support, the level of welfare benefit support. The carer support plan hasn't increased, as you mentioned, Mary, at the level that we'd like to, but still there is an increase in there. So it's shown that you're building on that work, and how do we make that more accessible and meaningful, as David has highlighted, and the young carer statement and the counselling sessions. I think in your report there's significant achievements. So I just want to pass on our thanks to everybody that's been involved in that work over the past number of years to get us to this position, and just to recognise that. Okay, thank you very much. So this paper is for noting for us today. So it's noting the progress and the performance that's been highlighted. So I think we're all in agreement with that. Okay, I can see lots of heads nodding. Okay, thank you very much. And the next part, which is agenda item number 7, which is East Lothian Carer Strategy, and that's with yourself, Maria, for 26 to 29.
Thank you. So I suppose, having presented some of the achievements under our previous strategy, this is to present the updated carer strategy and some of those continuing themes. So a bit of a shorter presentation, you'll be happy. Ailey, are you able to bring that one up, please? So this will be, thank you, our third local strategy, and each one, as we've talked about, has given that framework for the kind of improved recognition and support for carers. So I'll just talk you through how we've got to this stage, the engagement process that we followed, and the continuing themes from the previous strategy. Next slide, please. So we do engage with our local carer population on a very much an ongoing basis. We have a lot of information from them relating to their experiences and the things that matter to them and will make the biggest difference. So we started from a point of what we already know, and what we already know is we still have work to do to help carers recognise their role and therefore access the support that is available. And we know that when they do access that support, it makes a really big difference to them. It increases their confidence and their ability to cope, and ultimately their ability to continue caring. We know that the number of carers is increasing, as is the intensity of support that they're providing for people with the increase in the older population, but also the continuing move to supporting people with more complex needs in our communities. We also have a huge amount of national research into carers' experiences. There's a lot of kind of generalised research, but there's also more specific stuff around the experience of older carers, for example, the cost of living crisis, and we draw on all that to understand our carers' experiences. Just to ensure we weren't missing any new local trends or themes, we issued a very short survey. And we know that asking for information through our trusted contacts, you've been talking about the third sector organisations there, it seems to be more effective, and that was confirmed. We put our survey on our kind of general consultation hub, and we only got about 15 responses, but through Carers of East Lothian we got 90, through our Young Carers Service and Advisory Group we got 8, and we also got some responses from Millen, who support carers from South Asian communities, so that's proved a really effective way of hearing from our carers. We also used the findings of the engagement report I mentioned around parent carers' experiences. We did an integrated impact assessment session that was held on the draft strategy, and it gave really meaningful feedback about equalities, which has been incorporated into the updated strategy and the actions added to the plan. The draft strategy was then available on the consultation hub from mid-February for about a month, with us getting online feedback from 25 individuals and organisations, plus much more in-depth feedback from our carers organisations, as you mentioned, and from our carers rep here today. Amendments were made based on all that, giving clarity in some areas around language and making carer empowerment a standalone outcome. Next slide, please. So just looking at those continuing themes, some of it we've talked about already, the carer identification, it continues to increase, but we're aware that some groups remain underrepresented within that, particularly carers from minority ethnic communities and those less likely to self-identify. So we've got work to do there to actively reach out to these underrepresented communities. The expansion of the information that we give, the welfare advice and the communication formats we've used has all been really positive, but carers are still telling us that they have difficulty navigating our systems and knowing what is available, so that remains a priority too. Next slide, please. Delayed access to support, that remains an issue with carers, often reaching services at crisis point rather than getting support early to help sustain their caring situation. Awareness, like you've said, across everyone, but across primary care, particularly education, employers, is increasing, but it can still be inconsistent. And progress highlights the need for these coordinated approaches that prevent crisis, support well-being and reduce inequalities. There is a high demand for breaks from caring and wider supports that kind of continues to exceed supply despite investment and innovation that we've made. And this seems likely to intensify with the right to a break. So that's a priority under this strategy and one we know will take significant time and investment to change. Our engagement structures through our carers panel, our young carer advisory group, our forums are in place and they are growing, but there is more to do to consistently embed people's lived experience in all our planning and decision making. Next slide, please. Delivery of this third carer strategy will focus on targeting inequalities, embedding early intervention, doing more of what works and preparing the system for potential increased demand and new legal duties, particularly around the access to breaks and support planning. The overarching actions have been summarised in the strategy under each outcome, but that has also been developed and presented in the associated action plan. And just to say, if people are reviewing that is intended to be a working document, and we're still developing that with our delivery partners that we've mentioned. As reported in the previous paper, we're working on a performance matrix for this strategy so that we can report on the achievements, as I've just done for the previous one, and updates will be given to the strategic planning group, the carers panel and the young carers advisory group. The IJB is asked to note the development of the strategy informed by the significant engagement with all our relevant stakeholders, note the outcomes and the continuing themes as presented and summarised in section 3.6, and to approve the strategy. Thank you.
Thank you. Thank you very much, Maria. I'll just open up for questions and comments. I'll just start, Maria. Oh, David.
Thank you. This strategy is important because every strategy is important, but it builds on what has gone before, the good work that has gone on, the achievements that have been made. So there's a continuation, but it also includes new elements. It's looking at new areas, it's looking at new targets, it's looking at new aspirations. And these have all been identified not only from what has gone before, but through a very solid consultation process with carers, consultation both formal and informal, and that is in itself a success. I particularly welcome the inclusion of the carer empowerment section. I believe this to be particularly important and timely. If we give carers the tools to identify and respond and to lobby and to engage with us in a more professional, competent way, we will get better outcomes. Collectively, we will get better outcomes, and that is very, very important. That's what it's all about. I therefore commend this strategy to you.
Thank you very much, David. Appreciate those comments. And Tricia?
I think I must just be an echo machine today, because I would like just to echo David's comments. And if you ever want to think about whether we've moved forward, look back a few years to where we were previously, and seeing carers being recognised now, whether it's in East Lothian or further afield, it's just being done so much better than it has been in previous years and previous decades. So again, the fact that this is front and centre of what we're looking at today, I think has been a huge step forward. So I'm going to echo David's comments and again commend the work that's been done on this. I think it's really impressive. Thank you very much.
Thank you very much, Tricia. Do you have any other questions or comments for Maria? Maria, just one question that I had was, this is a really comprehensive strategy and you've talked a lot about engagement. One thing we do get asked around is, that was mentioned at the Dunbar Dementia Support Group, was we fill them in. Do you have any way of being able to feedback to say, you said we did, so it does matter what you say because this is part of our way forward, you know, so it is important that you tell us your feedback because we use it to then determine how we're going to improve things and make life better, the quality of life better for carers.
Yeah, so I don't think there's kind of formal processes. When anyone completes anything on our consultation hub, they can get updates there to say the strategy has now been published. You can see where your feedback has been used. We also let local groups know like that, especially the ones that have helped us engage with people. So the Carer Centre will obviously share that, and the young one as well. So we kind of try and share that with local groups. We do an update each year, as I said, to SBG in terms of our kind of achievements, but we also do an update our previously years I have anyway around we said we did, like updating the action plan to just show exactly what's happened. So that's available on our website. How accessible that is to your average day carer, I'm not sure, but we do try and get that information out there and share it as much as possible, especially where people have given us their feedback.
Okay, thank you very much. Secondly, was just around the engagement. You've said that the consultation hub, you did get some feedback, but it was quite limited. But through your trusted partners, the feedback was quite significant. How could we continue to build on that? Because we want to get as much feedback on this area of work as we move forward.
So I think that's something that Kate is exploring as well around our participation and engagement approach in general. But I think that is very much what it's about. It's about identifying those trusted partners and reaching people through that, because especially when we're talking about people that don't potentially identify and recognise their caring role, we need to get to them somewhere else because they might not be engaged with carer support. So it's about being part of those other organisations that are community-based organisations where people are as well. And I think our Equalities and Engagement Officer is particularly good at that, at reaching out to communities and being really involved there. So that's been really beneficial.
Okay, thank you. Thank you very much. Just want to check if there's any other questions or queries for Maria on this one. I don't see any other questions or queries, Maria. Just want to say thank you very much, because we had quite a lengthy discussion at Strategic Planning Group on this, and it was good to have more of a discussion at the IGIB today. But just firstly, as an IGIB, we absolutely recognise the value and importance of carers, and we recognise the barriers, as outlined in your report, the technical report, the many barriers that carers face, and how we work in partnership with them and across the organisation and with our partners to make sure that we improve and support our carers in the local community in East Lothian. I know over years that carers of East Lothian have done an amazing job in supporting carers, and you could see that not just in the numbers, because I think it was last year, March 2026 was around 7,000, and that's more than a number. It's 7,000 individuals, carers, people, families that have had an intervention in their life to make it better, who are maybe looking for help and support. So I think today is just to signal the importance that this area of work is to the IGIB, recognise the achievements and just to endorse the strategy, Maria, and to thank you for all the work and all the other team members that have been working with you and our partners. As you mentioned, David, the third sector play a huge partner with us to support our carers and how we build on that. So thank you very much for the work, and I think we want to continue supporting you. So if there's things that you think that are important for IGIB members to increase their awareness of work supporting carers or the carer strategy, then please please pass that on, and we'll make sure things like the Carers of East Lothian AGM is always a really important event and a really powerful event to hear about what the organisation's been doing and to hear from carers themselves. So for today, just to thank you for the report and endorse it and to approve the recommendations. Are we happy to approve? think there's quite a few nods of head, so we're happy to approve. So thank you very much. We'll move on to agenda item number 8, which is the East Lothian IJB directions for 26-27. And I think, is that with yourself, Laura?
Yes, it is. Thank you. So this is just to present the IJB directions for 26-27. You will note there's been minimal change from 25-26. We did have an addition in 25-26 around unscheduled care. I would expect directions to develop over the course of this year, particularly as our programme boards mature in their governance processes. To confirm, we have sent the draft directions that were discussed at the SPG to our partner chief executives for comments, and having received no comments back, if after the IJB approval today, they will be then formally sent to our partner organisations for them to dock at their relevant boards. So it's just today to present the directions and to get the approval of the IJB, and then they'll be signed off for 26-27.
Okay, thank you, Laura. Can I just ask if there's any comments or queries on the IJB directions? No, I don't see any hands up for any questions or queries. Okay, and Laura, you mentioned there isn't a huge number of significant change to it, but you did mention some things at the end. I wonder if you just go through where you've mentioned the changes. You'd mentioned unscheduled care, so that's the only addition that's had to be made.
That was made in 25-26, so you saw that in 25-26 as a draft direction, so that came up last year. But then there's no other, I mean, we'd keep our cores, the core directions stay, it's just those specific directions. So there's been no changes for 26-27 in this document. But like I say, I would expect as the programme boards develop and they have their own work streams that we should see directions coming forward.
Okay, thank you. What stage do you think the programme boards will be in to be able to pass? I'm just wondering when we might revisit this if programme boards are putting forward new directions. So
if new directions are proposed, they will go up to the SPG and to the IJB for approval, and then they will be placed in the directions book. I think that's a better word for that. And then you will be presented with the full directions again in 27 for 27-28. But yeah, if the direction comes up, then it will come to the IJB for approval first. Okay, thank you. I don't think there's any other questions or comments on this. So this is an ongoing document that will come back to us when changes are being made by the newly formed change boards. Okay, so for today, so this is important. It's important just to set in clear direction of travel for us, and just clearly specifying our direction of travel for the NHS and our direction of travel to East Lothian Council as an IJB. And hopefully we'll see some of those directions and seeing some of those changes around for example, like the set aside services we've talked a lot about. We see that we've got this down as a direction of how we continue to work with the NHS to look at how we can look at different ways of working and different delivery of services in that area. Okay, so we're happy just to endorse the IJB directions for today, and knowing that they will be subject to change as the change boards carry out their work. Okay, thank you very much. That's agreed. I'll move on to agenda item number 9, which is a Community Planning Partnership Local Outcome Improvement Plan, LOIP. And I know at the NHS Lothian Board, part of the paper on a public health organisation, there was reference made to local outcome improvement plan. So this kind of brings to life what we discussed yesterday around community planning partnerships and the work coming forward. So I think that is with yourself, Fiona and Eamon.
Yeah, no, thanks, Shameen. Fiona's here and Emma Brown's here as well. So they're going to take us through, Emma in particular, on the report itself. But it's just to advise that the paper itself was approved at the East Lothian Community Planning Partnership Board on the 9th of March this year, Shameen. But I'll hand over to Emma, who's going to take the panel through.
Thanks. You. Thank you very much. Thank you, Eamon. Thank you, Emma. Welcome.
Brilliant. Thanks. I'm just going to share my screen and just take you through a few of the the key points of the plan, but as Eamon's mentioned, it is for noting for members and also to bring members up to date on the change of language and branding that we're using around the partnership. So previously, you'll be aware the Community Planning Partnership was known as the East Lothian Partnership, and through the consultation and engagement that we've done over the last couple of years, we were aware that people within our community weren't always aware of what the East Lothian Partnership was. So we've stripped back a lot of the language to what is pertained within the Community Empowerment Act. So we've got our new partnership logo, and we've also got a bit of a strap line, which is around working together to promote healthy, safe communities and reduce poverty. Just as a bit of a recap for anyone that might find it helpful, community planning obviously sits within the Community Empowerment Act, and it's about how we can work with communities to provide better services with their input. It's around early intervention and prevention, how we can address poverty and inequality, and where the collective efforts of partners can work together to make lives better in East Lothian. Under the Community Empowerment Act, we've got a statutory duty to produce 2 different types of plans. The first one is our Local Outcome Improvement Plan, which covers a 10-year period and is East Lothian wide. And the second is to produce locality plans in places of deprivation. In East Lothian, you may be aware that we actually have 6 of those plans, which span 5 years and cover our 6 area partnership localities. We, as Eamon mentioned, approved the plan in March 2026, and that followed quite a lengthy period of co-production with communities, which started back in December 2025. And that included the representation of nearly 25,000 voices, 10,000 of those coming from our children, young people and families, and 15 from our communities. I think, as has already been mentioned, a huge part of that work involved the engagement of our voluntary sector and those who are working on the ground, who have trusted relationships with our communities, where people feel a trusted relationship allows them to open up and share about the issues that matter most to them. What we also did do was we did pull together a huge range of data through consultations and strategies that was also taking place to ensure we weren't asking people the same questions, and also aware that the IGB strategy was being developed over the same period. And I was meeting with Claire Goodwin and Kate Thornback bi-monthly to discuss where crossover might be happening in terms of what we were hearing. In terms of going out to communities, we obviously had to highlight some of the key issues that were in the strategic needs assessment, and none of these will be anything that is mind-blowing to you. Obviously, around our growing population being the 2nd largest growing local authority in Scotland, the extreme budget pressures that we're facing, the impacts of climate change, housing, which we've already discussed on today's agenda, and obviously the growing issues of poverty. So we went and spoke to communities. The 3 key themes that they came back on were health and mental health, feeling safe at home and in the community, and tackling poverty and inequality. Important to highlight, there was also some undertones of themes, things around climate change, transport and participation and voice. We worked with an officers group, which included representation from the Health and Social Care Partnership, and we reflected on the fact that communities had told us that the language that we use is really important. So we've changed the 3 themes to living well, which takes into account health and mental health, keeping safe, and money matters. Obviously, we're aware that poverty doesn't just encompass money, but often when communities were speaking about the impacts on their lives, it was money that they were talking about. So under each of these 3 key themes, we have priority areas, and obviously recognise that there's crossover with the IGB in terms of lots of those areas, but probably most closely aligned with that first area under living well. Most of the actions that we've identified look to community support, peer support, and providing tools to communities so that they can feel empowered in their own lives to bring change, rather than any interventions or services. Under each of the priority areas, we've got year 1 and year 3 actions, and we've limited those to either between 1 and 3 so that they are achievable and focused. In terms of the delivery of those 3 key themes, we've established a new Living Well strategic group, which is being chaired by Kat Burke from Public Health and Maureen Allen from VCEL. We have a new oversight group, which is starting within the Keeping Safe area, which Leslie Brown will be chairing. And our Money Matters work was already quite far progressed with our poverty plan, which was produced a couple of years ago. So the poverty working group is taking forward that piece of work. We're currently working similarly to the IGB strategy on our performance framework, and we're working towards that for September 2027. I thought it was maybe helpful to also highlight that we've been on a journey of improvement. We worked with the Improvement Service back in December 2024 on a self-assessment process, and these were the 4 key improvements that were identified within our plan. We've had a review of our board, which now includes the 3 key leaders of the parties and also community representation from our area partnerships, our tenants and residents panel, and also our Association of East Lothian Community Councils. Governance and accountability has been a kind of second core theme, which I know Kalonji, who's in the call today, has been working on through new terms of reference for the group, and also induction and membership packs. Strengthening the impact of our work is really key, and I think again how we present that to communities, so presenting stories around the ways that our agencies are working together to bring about change has been really key, and that's something we provided in our last impact report. And lastly, we've been looking at our approach to community engagement. So similarly to Kate Thornbank, and I'm working closely with her, we're working on a East Lothian Community Planning Partnership engagement and participation strategy, and that will also align with the current work that's being undertaken in East Lothian around the peer review for our community engagement. So that's just a bit of an overview on what's been happening, and I will pass back to Shameen.
Thank you very much, Emma. You've really succinctly, very quickly summarised a huge amount of work that you've been doing behind the scenes and out and about on this really big, significant report. So thank you very much for doing that so succinctly and covering so much in those few slides. So thank you very much for that and all the work that's gone into it. I'm just going to open that up for any questions or queries for Emma. Just going to see if there's any hands up. No, I don't see any hands up. I know that we did, you presented this to the strategic planning group, and I wonder if you could say just a little bit around the work that you've done with Claire Goodwin, because that's really important, that IGB strategic plan that you kind of just touched upon. And I just wondered, for reassurance of members that are not on the strategic planning group, of how closely you've been working with Claire Goodwin, of how the IGB strategic plan is alongside this local outcome improvement plan, just for reassurance that we're all working in the right direction.
No problem at all. That's absolutely fine. As I mentioned, I was meeting with Claire and Kate bi-monthly, and particularly when we were looking at the engagement piece of work that we were undertaking, because it was such a large piece of engagement, we often got quite a bit of feedback that maybe wasn't particularly relevant to the local outcome improvement plan, but perhaps could be passed on to colleagues and relevant for other strategies. And certainly there was a number of areas where it was relevant to the IGB's new strategy. There was stuff around frailty and falls, acute admissions, a range of work in that sense. I think the other thing that we were talking about is making sure that we weren't going to the same people and asking the same questions. So I suppose where we could share data between ourselves, that was really important. And I think it's important to highlight that that's continuing in terms of how we can continue to capture the engagement that we're doing and provide that information that's up to date to partners, both between the IGB and ourselves, that can inform any future work. So many of the people that are on the call today I've been having lots of conversations with, including Marie, who was in earlier. Housing's been another key point. So I suppose it was a way of kind of coordinating and passing on information and keeping that communication open going forward.
Okay, thank you very much. And then just as we move forward, there's quite a few actions in there for the Health and Social Care Partnership. I just wondered, as IGB members, what is the best way for us to be aware of the governance and progress reports and updates?
Can I come in there, Shameen? Yeah. And Fiona McCallum might want to come in as well on top of that one. Just before we do, Fiona and Shameen, I just wanted to shed a light on the connectivities and the joins here around Fiona's report in carers, David's point around collective partnership achieving more. I think this report shines a real light on that. and obviously it's a compass for us for the next decade, 26 to 36. But Fiona, do you want to come in on Shameen's point around that governance, etc.?
Yeah, thanks, Eamon. Thanks, Chair. Good afternoon, board members. So yeah, around the governance, I think we've probably had a few changes around community planning recently. I'm relatively new in the organisation, my team is quite new, and Emma, as you know, has been doing a sterling job with community planning over the last couple of years or so. So a big thanks to Emma for doing that. So in terms of the changes, Emma's going to continue to play a key role in the operational delivery of the LOIP, while my team will take on the strategic oversight of community planning going forward. So we've got an immediate focus on getting a performance management framework, which will include reporting arrangements and frequency, and also a robust delivery plan for the LOIP as well. I would caveat that by saying that is dependent on my resources within my team, which I don't really have at the moment. I'm working on that right now with a bit of a structured review and hoping to get resources in place really quickly. But these are definitely the priorities for my team in terms of that. So we can come back with the performance management framework and the delivery, if that would be agreeable to yourself, Chair.
That's great. Thank you. Thank you very much. Just want to ask if there's any other questions or queries for Emma or Fiona or Eamon while they're here. I think you're absolutely right about the collective effort, and that really comes clearly through the report, and it's important for us as IGIB members to see that progress being made. Just seems like a real drive forward of doing things, learning what we have learned from previous community planning partnerships and how we move forward. So it's really heartening to see NHS Lothian representation and VCEL taking forward that lead around and living well. Okay, Kalonde?
Yeah, I was just going to say that, yeah, I think the partnership is very important because, as we've seen from previously when Claire presented on the annual delivery plan, a key part of that is how it links to the community planning partnership work. So that's why it's really important that we get it right. And it's good that, the appropriate key stakeholders are engaging with one another. Thank you.
Okay, thank you. And David?
Just very briefly to say, I think it's very impressive the way in which you've stopped using a foreign language and used the language of the people in your way that you're describing things. That's really important. It's good communication.
I don't know if you want to touch upon that, but yeah, that comes across.
I think Emma will want to come in. I think that
okay.
Was really apparent, but Emma's probably best placed.
Yeah, I think that was the biggest bit of feedback that we got from communities, that they didn't understand the language that we were using, and we've really tried to present it in a way that people understand and can identify with. And we used quite a bit of different types of engagement to check the language with people. Interesting, you were talking about the consultation hub yesterday, earlier on, and Fiona and I have been having conversations around that. We actually chose to go away from the consultation hub and use SurveyMonkey and videos and rather than lots of papers, and I think that led to us getting much better engagement and also just checking in. I think that you've said, we've heard, we're doing is really, really important, and I think that also fed through in terms of people feeding back on the language and the statements that we were using.
Okay, thank you very much, Emma. Thank you, David. That's a really important question around language and what we're trying to do and people understanding what we're trying to do and trying to improve outcomes. I just want to check if there's any other questions or queries for Emma, Fiona or Eamon while they're here. No, I don't see any other other hands up. I really recognise all the comments that have been made and just echo those comments, especially around the language, and just to thank the significant amount of work that's gone on in this area. And I know, Emma, you presented it. I've been to a couple of things now where you've presented really well, just huge significant pieces of work really succinctly across, and I think it's really important that we articulate collectively that our primary purpose is to make sure we're making a difference to the lives of the communities of people in East Lothian, and living well, keeping safe and money matters is really clear, and we can then be held accountable for those those priorities that we've set, and how we use our resources, use our collective effort to make that difference, and just see how we improve outcomes for our communities as we move forward. So a huge thank you for the work that's gone on in this piece of work, and for your presentation today, Emma and Fiona and Eamon. And so for today, it is for us just to endorse it and to note it. And do you see yourself coming back after a period of time to provide any update or progress, Emma, Fiona, or Eamon?
I think Fiona has said, there's a willingness to come back if board feels that's important. I think it'll be really, really important that we're all represented at the Community Planning Partnership Board, and we get our monitoring, our performance and our delivery in there. But if there's a field we want to come offline and come back, I'm sure there'll be a willingness to do that, Shameen.
That'd be great. I think I suppose when you look at the work, the strategic directions of the IGB, they kind of impact on all of these areas in one way or another. So that'll be useful further on down the line. So just for today, to thank you for the presentation and for the work, and thank you for everybody's contribution. And we're happy to agree the local outcome improvement plan. Okay, I can see a few nodding heads there. Okay, thank you very much. Move on to agenda item number 10, which is the 25-26 draft unaudited annual accounts. Is that with yourself, Mike?
Yes, thank you, Chair. So just to bring you up to speed on where we are with this before I go into the paper, the Audit and Risk Committee on the 16th of June of this year recommended that the IGB approve these accounts for presentation, for audit and for publication on the website. And this paper brings that to the IGB. So the paper presents the IGB's unaudited annual accounts for 2025-26, and it seeks approval for them to be published on the website and presented for audit. The paper sets out the legal requirements we have to produce a set of annual accounts every year, and the established process that the accounts follow to their final presentation of the audited accounts to the Audit and Risk Committee and the IGB in September. So we will bring the audited accounts back to the Audit and Risk Committee and then the IGB in September. The report just highlights the main sections of the accounts, and as always, I'm grateful for those who have contributed to the production of these accounts, and I'm happy to take any questions.
Thank you very much, Mike. I'll just open that for any questions or queries for Mike on the unaudited accounts. I think we had a discussion at audit and risk, and there wasn't any significant concerns around what was presented to us. Mike, I don't know if there's anything else you wanted to add to that.
No, a few typos, a few suggested changes of wording is what we received, and we'll make those adjustments at the appropriate time and make sure they're in the final accounts.
That's grand. One area that I'm reflecting back was around some of the challenges that we faced around finance was recruitment, and I think that was one of the areas that we did talk about, to make sure that we articulate clearly if there were any challenges that we faced or underspended around the challenges that the Health and Social Care Partnership faced around on the issue of recruitment.
Yes. Okay.
All right. I just want to check if there's any other questions or queries for Mike. No, I don't see any other questions or queries for you, Mike. So today we've just been asked to agree the unaudited accounts, and they will be audited, and then, as you mentioned, go back to the Audit and Risk Committee. Yeah. Okay.
Yes, that's true. That's it.
Okay. All right. Well, Mike, just to say from the IGB, thank you very much for the work that's gone into pull these accounts together. I know there'll be people from both partner organisations that have been involved in pulling them together, but I suppose it focuses the mind in the first few pages of our purpose of the IGB. When you look at the plethora of services, well, there's numbers there's services that staff are delivering that are making a difference to the outcome for people across our communities in East Lothian, and that's important. Okay, and just to thank both partners for the support that they've provided us to be able to have broken even over the year.
Yep, thank you.
All right, I don't see any questions or queries for you, Mike. So I think we're happy to agree the unaudited accounts. Yeah, I think I see a few heads nodding there. Okay, that's agreed. Okay, thank you very much. That's the end of our agenda. So thank you very much. Maybe we should have had a hydration break today, but I think we've managed through it. So you've got 25 minutes of your time back. So we might have a hydration break there. So thank you very much for everybody's contribution. I really always appreciate everybody's attendance. So thank you very much, and we will see you soon. Thank you.
Thanks, Jermaine.
Thank you.
Hayley, can you stop the recording, please?